what medications they've been tried on, what allergies they've had in the past, how they've sort of reacted to medications, and things like that is very useful to know before you make an informed decision about the patient's care. Because what we don't want to do is think that this is going to be okay for the patient and then start that treatment and then find out that things have gone wrong in the future. But I think to make an informed decision and to do what's best for that patient, it would be useful to know what their background is, because many times they aren't able to tell you. Useful to demonstrate. Like the other day I had a patient who is known to be a diabetic. He had high blood pressure as well, and we were monitoring his kidney functions to see if he was developing any sort of complications from the diabetes, and I looked through the results and I found that he was leaking some proteins, which is the first sign of kidney damage. And then looking back through the notes, or looking back through our sort of blood test results, he'd had that for a few months, but it was actually getting worse. Now, for that particular condition, he should have been started on a particular medication which also helps control blood pressure, and I asked him if he was on it, and he didn't have any clue. So what would have happened in the absence of EMIS is that I would have written to the GP to say, he needs to be on this medication. Please will you make sure that you have a look at his blood pressure to see if he can tolerate this medication and start it at small doses, which when we see them back in clinic at the end of 3 or 4 months may or may not have happened. But on that particular occasion I was able to look at his summary care record. I knew he was on the medication already, but he was on a dose that could have been increased, and now what I needed to do at that point was to see whether his blood pressure would allow us to increase the dose. And of course there was the sort of trend of blood pressure readings that he'd been sort of had taken at the GP surgery, and I was able to look at the trend, and I knew that his blood pressure would tolerate an increase in the dose, and I was able to do it then and there. So controlled his blood pressure better, tackled the kidney problem. We didn't waste 3 months, and again it was like I could do what was right for the patient just there, without having to waste time and effort running around getting somebody else to do the job, which I should have really done myself. So I found it very useful.